Hello and welcome to this session of the medical debate where we will be talking about inherited diseases. So how do diseases get passed down? So for example, there's one called cystic fibrosis, which everyone should have heard of. It's a hereditary disease that affects the lungs and digestive system. The body produces very thick and sticky mucus when it is infected with cystic fibrosis, and this blocks the lungs and can obstruct the pancreas. This can shorten the lifespan of the patient, and it can also lead to general lifelong difficulties, and this is a recessive disorder. There's another one called Huntington's chorea. This is a neurodegenerative disease. The condition keeps getting worse, and there is a general lack of coordination or control during walking. And this is a big symptom in advanced, in people who are older and have Huntington's chorea. And it can cause depression. There is no cure for Huntington's chorea, sadly, and this is a dominant disorder. And we will explain what these terms mean in a few minutes. So at this point, I'd like you to think about what the role of a parent is. It's quite important to think about this because this actually defines a lot of our understanding, because and you'll see why this ties in later, but it's very important to understand what exactly the role of a parent is. So I'll give you a few seconds to do that. Feel free to keep the video playing and to carry on with the presentation, or if you'd like, you can pause the video now and think about that and write some ideas down and play when you're ready. So we're going to look at Punnett squares, and this is basic genetic biology. Punnett squares can be used to find the likelihood of a child of having a certain phenotype. A phenotype is basically having a certain type of physical trait, a physical manifestation of a trait based on the parents' genotypes. Genotypes are basically the genes, the individual alleles. They can be used not only to find the likelihood of having a disease, but also finding out if they will have any feature governed by a single allele. To successfully construct and understand a Punnett square, you need to know the genotypes of the parents for that specific trait and a knowledge of how to use the Punnett square, which we will demonstrate. First of all, we're going to demonstrate some terms and define them because it's very important to understand what we're talking about. So first of all, heterozygous, that means having two different alleles in the same trait, for the same trait. You could be homozygous, which means that having two of the same alleles in a certain trait. Dominant, a dominant allele is one that supersedes the recessive trait. If there is even one present in a child's genotype, then that gene will be portrayed, and that trait will be portrayed, that phenotype. That is caused by the dominant. And recessive, a recessive allele is one that will not be expressed from the genotype in the child into the phenotype unless two of the recessive alleles are present. I know this makes no sense right now, but it'll become clear when we show you the demonstration. Dominant alleles are normally represented by a capital letter. Recessive alleles are normally represented by a lowercase letter. A carrier is a person who has the recessive allele, but due to them having heterozygous alleles in that respect, that genotype is not expressed in their phenotype, so they do not get affected by the disease or trait. So these are the instructions for constructing a Punnett square. So you define the phenotype of each parent, you write it at the top. You define the genotype of each parent, and you write that underneath that. Remember to use letters which look different in capital and lowercase for the two different gametes. You create a 2x2 grid with the rows labeled with one parent's gametes and the columns labeled with other parent's gametes. Like in multiplication, you multiply the terms to get 4 pairs, and you calculate the probability of getting the trait based on the 4 possible pair of alleles in the offspring, and remembering whether the disease is dominant or recessive. We will now demonstrate an example of a Punnett square diagram through modeling the likelihood of a child getting cystic fibrosis if both parents are heterozygous. Remember, cystic fibrosis is a recessive disease, and watch carefully, you will be asked to try this after this slide.
So, as we discussed at the beginning, cystic fibrosis is a recessive, and that means that it's caused by the lowercase allele. If you have both of those, then it will be expressed. And we know that the dominant allele, i.e. a capital letter, will take priority. So if someone has a capital letter, then they won't have cystic fibrosis. It can only be formed if you have two lowercase letters. So we're going to do an example now of where both parents, I hope I've got the, if both parents are heterozygous. So excuse my handwriting, please. It's on a bit difficult to write on the screen. Yeah, so both parents are heterozygous. And we're going to represent the different alleles by the letter A. So we know that cystic fibrosis is recessive, and therefore you would need 2 lowercase a's for it to be, for it to be expressed. So if both parents are heterozygous, then we know that parent 1 is going to have capital A, lowercase a, and parent 2, which we're going to show on this side, I'm just going to put 1, 2, is also going to have the same. So we can put this into a little table, and then we can kind of multiply them. So these are the possible combinations which could form were these 2 parents to have a child. So we can see that we've got 2 capital A's here, capital A, lowercase a, capital A, lowercase a, and then 2 lowercase a's. Right, and this kind of shows possible combinations of alleles that could be formed. And we can see here, these 2 capital A's they're both dominant, and therefore the allele for not expressing cystic fibrosis, they're both there, but the allele for expressing it isn't, and you need 2 of those. And in these ones, I'm just going to draw this in blue. These are heterozygous, and you've got 1 allele for expressing cystic fibrosis, but the other is dominant, so that kind of overrides that. So in these children, there is also going to be no cystic fibrosis. But in the final possibility, we've got the right combination, and therefore we know that this combination can lead to cystic fibrosis since both alleles, are correct. They're both recessive, and these 2 possibilities are carriers because we've got the allele there for cystic fibrosis, the lowercase a, but it won't be expressed in that person. So if these parents were to have a child with the genotype capital A, lowercase a, that child would not have cystic fibrosis because cystic fibrosis is recessive, but they would be a carrier because they've got the allele for cystic fibrosis, even though it's not expressed. So their child could potentially have it if they were to go through this, if we were to do another Punnett square. So yeah, that brings us on to, I wonder if in the chat you could put in your suggestions, therefore, of the percentage chance of this child getting cystic fibrosis. I know someone's already done it, but if anyone disagrees, then please put your ideas in the chat. Yeah, so I think you've all got it. It's quite basic, really. It's just you can see here that out of the 4 possible combinations, there is a 25% chance of this child getting cystic fibrosis. And obviously, if the parents had different genotypes, then the outcome would be slightly different. Yeah, I hope that's explained it quite well. And in a second, you'll get to do this yourself.
So here's the question. A couple, Grant and Lana, want to have a child. The mother is homozygous recessive and the father is heterozygous. Huntington's chorea is a dominant disorder. What percentage chance does this child have of getting the disease? I want you to try this out for yourself based on the example that we just saw and see how it takes you and how you get there. If you have any questions, please feel free to put them in the comment section and we'll get back to you as soon as possible. So in this case, think about making the Punnett square, thinking about the instructions that we did earlier in this presentation, and think about the different letters you can use. Remember to define the phenotype and the genotype, and try and understand what percentage from the 4 pairs that you get. You can pause this video right now if you want to try this out, but if not, I'm going to continue talking and I'm going to explain what happens. So in this case, you would draw a table, and the mother is homozygous recessive. So that means that she would be small a, small a. The father is heterozygous. That means he is capital A, small a. The genotypes, as we said, as I just explained, they explain the phenotype. So the phenotype would be if the parents actually have the dominant disorder, if they have Huntington's chorea. Okay, so think about this. Grant, the father, is heterozygous, which means he has one dominant allele and one recessive allele. If Huntington's chorea is a dominant disorder, that means you just need one dominant allele for that person to have Huntington's chorea. And Grant is heterozygous, so he does indeed have a dominant allele, which means he does indeed have Huntington's. So Grant does have Huntington's chorea. Lana is homozygous recessive. So she has little a, which means that she does not have the dominant allele, which means she does not have Huntington's chorea. And that would be how we define the phenotype and the genotype. Now we would draw the table. So in the top row, you would have small a, and then in the second column, you've had small a again, because the mother is homozygous recessive. And then in the first column going down, you would have in the first row a big A because he's heterozygous, the father, and little a because he is having two different alleles. You would multiply them out and think about this. You have little a multiplied by little a multiplied by big A, little a multiplied by big A, and little a multiplied by little a. Because of this, there is a 50% chance that the child has Huntington's chorea. I'm going to stop for a minute to let that sink in and for you to just check your answers. And we will resume after 1 minute. If you wish to, you can skip forward 1 minute in time and we will see, move on to the next slide. 1 minute starts now. Okay, so that's 1 minute up, and you should have got the answer 50% chance of getting the disease, and therefore 50% chance of not getting the disease. Again, this is only a probability, so we can't be sure. Is it ethical for two heterozygous parents, carriers of a certain recessive disease, to give birth to a child? What if the parents did not know they were carriers, and what if they did? So I'm going to give us 3 minutes to think about the answer to this question. And it's very important that you think about the 4 pillars of medical ethics, as well as thinking about the ethical side and the ethical viewpoints of the child. Would they want a life if he has a high chance of getting a certain recessive disease, such as cystic fibrosis? And think about the different viewpoints. 3 minutes start now. Okay, so that's 3 minutes done, and we just like to think, there are many different ethical views that we could take about this. If the parents did know, then maybe they wouldn't choose to give birth to a child who might be in pain or might suffer, or they might be ready to help that child out and still give birth. It depends on the parents. And again, we cannot answer this sort of question unless we're really in that frame of mind. But it's very important to think about both sides of the argument and to think about as many ethical points as possible. As always, please feel free to put your answers in the comments so we can look at what you said, and we would love to reply to you as well. And we would love to see how you thought about this and what your thought process was. So please feel free to elaborate by adding your reasoning and your judgment. Okay, would it be unethical if carrier patients were legally not allowed to have children? So the main thing to talk about here is autonomy. Autonomy is a medical principle that says that you need to let patients have their own choice. And the fact that you're not giving parents the choice to have children is highly unethical, surely, because on the one hand, because one ethical view would say it's highly unethical because they should be allowed to have children, and they should be allowed to take care of the children if they wish to, even if they think that the child might be a thing. Child might be susceptible to having a recessive inherited disorder. However, you might also think that, well, they're carriers, and so there's only a slight percentage chance that they have that certain disease. So let's say that they don't get the disease, because it's a probability again. So let's say they don't get the probability of, they don't get the disease, then, how is it fair for these people to not be allowed to have children? So it's very important to think about it that way as well. It's very important to take both sides into account. There are other arguments as well to make, but I'm giving you the basic one so you can think ahead and think about your own points of view. And I highly recommend you put new points that you may come up with in the comments section. Thank you very much for listening to our session today about inherited disorders. We hope you enjoyed it, and we hope you learned something. As always, you can contact us on themedicaldebate@gmail.com. Or on Instagram @themedicaldebate, where we post information about live events we hold every Saturday between 4 and 5 p.m. We also hold Zoom events between 4 and 5 p.m. and we talk about different medical aspects, and actually those events are the ones recorded that we put onto Vimeo. So it's very important that you take a look at those, and if you wish to sign up for those Zoom events, please email us on themedicaldebate@gmail.com, where we will send you a link. Thank you very much for coming, and we'll see you guys next session.